Hi, everyone. Welcome to yet another talk on mental health. But this time around, it's going to be a little bit in depth. We are going to talk about mental health in depth. My name is Faith Lukonde, and here I'm with Dr. Chambwe Chilambwe, who is later going to introduce himself further. Hi, Doc.
Hi, how are you doing?
I'm fine, thank you. How are you?
I'm okay.
Yeah, so I've introduced you to the viewers as Dr. Chambwe. Now, could you just tell us a little bit about yourself, what you do, who you are, and that kind of information?
Yes, my name is Dr Chambwe Chilambwe, medical doctor. For about, I think it's my 11th year as a medical doctor. And then I've worked in the mental space for 5 years. I've been working with my team, leading a mental health projects, which I've learned a lot. And one of my main interests is in preventive and community mental health, because I think that's the biggest gap we have in our setting, and that's what we need to focus on to offer support to our people.
Right. Thank you so much. Now, we're talking about mental health here, but let's begin. Let's start from there. What really is mental health?
Yeah, mental health is it's been a buzzword for quite some time. So a simple definition is a state of emotional, psychological, and social well-being that impacts the way you think, the way you feel, even the way you cope with various situations. So that's mental health.
Okay. We know, okay, maybe we've heard rumors, but maybe to hear it from an expert like you, how common is mental health?
Yeah. So mental health is everything that we have. I have mental health, you have mental health. And
Okay.
then there are what we call mental health illnesses and mental health disorders. And then you have to think about mental health in form of a spectrum. So you can find someone is of very good health, and then they can go down to difficult mental health where you might need interventions. So think about it as a spectrum. So according to WHO, about 1 in 4 people has a mental health condition, which is mild, can be mild where you can't notice, and functional, even up to severe. So it's something very common that we really need to be aware of as a community.
Ah, okay. So we're not just going to talk about mental health. I don't know if this could be described as a mental health disorder, but maybe let's talk a little bit about depression as well. What is depression?
Yeah. So depression, that one is a very common mental health condition that we have, and I think in someone's lifetime, I think they've met someone with depression. So depression is just it's a chronic feeling of negative thoughts, okay, and sometimes you feel worthless, and it's you have this for a chronic period of time, where you like a chronic feeling of feeling unhappy, feeling sad, and then it's like I said, it's a spectrum, and it can also affect the way you feel about yourself, the way you think, and it's very very severe, and it has numerous symptoms that we need to be aware of, and when it becomes very severe, you may need some mental health intervention by a specialist.
Huh. So now there's something that I need to ask about depression, but before that, what really causes depression?
So the one thing about depression is that there is no cause you can pinpoint.
Ah,
So if you think about how illnesses come about, not just mental health, everything, there's what we call the biopsychosocial model of diseases. So there's your biology for you, yourself, Faith. There's a biological you that I can see.
okay.
Then there's psychological you, which is your mind. I don't know what you're thinking about right now. And then there's a social you, which is your environment, how you grew up, where you come from. So all those things coming together, and then stressful life events where there's poor coping, and also maybe genetic predisposition if you've got family history of mental illness or depression, and also just poor coping mechanisms may lead someone to going into depression. So there's no pinpoint cause of depression, but it's like a mixture, cocktail of things that may come together, and then they may lead someone having depression.
But can someone know that they are depressed?
Yes, sometimes you can be aware about depression. One thing that even in this time around, people are confusing sadness and depression. Depression, like I said, it's chronic. long period of time, you're having negative thoughts about yourself, negative feelings, and it's negative changes happening, and then making you lose energy and you lose interest in yourself and environment in a longer period of time. Whilst depression is an emotion, whilst depression is a mental illness,
Okay.
and sadness is an emotion. We all feel sadness all the time.
Okay.
Okay.
So somehow they are mixed up.
Yeah, they're mixed up. So, for
So
example,
someone will just be feeling sad and they'll assume they are depressed.
yeah. So usually there's a cause for sadness. Today in the morning when I was making my breakfast, I dropped my bread on the side where the peanut butter was.
So you get very
That
sad.
made me sad for that period of time. Luckily, I got another thing and then I moved on. So
Okay.
something happened and then, it goes away. It's like a stressor that comes in or just an activity that takes place that makes you sad. And then the things that happen to you, the negative actions that make you sad or the negative events, sometimes are more intense. For example, things like grief, that's an intense form of sadness where there's sorrow involved. And then there's also sadness that comes from possibly a job loss and all those things. So all those things happen, but the difference between sadness and depression is that sadness is not doesn't happen for a long period of time, and usually you are functional. You can go for work after some time, and you can still socialize with your friends. Also, in depression, if you have depression for quite some time, you find that there's a reduction in appetite, poor feeding habits. You sleep too little or you sleep too much. You will lose interest in things that you used to enjoy doing before, and just have low energy. You don't have any motivation to go for work. Don't have any motivation to bath or brush your teeth. So those are the severe forms that do take place of depression.
It's very bad. So are there types of depression? I've heard people talk about different types of depression, and one that I want you to talk about is the functional depression. I don't know if it's there, where somebody is depressed but they're functioning somehow. Is it there? Is it true?
Yeah, that one I've read about it. God, functional depression is kind of measured in the moderate type of depression, where
It's not it's not intense.
so in your brain chemicals are slightly imbalanced, but you're able to function. Like I said, 1 in 4 people is a lot of people. So sometimes before something progresses to being severe, you may go through things of still being functional, whilst they can it becomes severe.
Are there any other types apart from that one? Are there any other types of depression that people are likely to experience?
Yeah, there are numerous types, and as you may know, depression is what we call a mood disorder. So there's a depression that's related to what we call bipolar, where sometimes it can be manic and then also depressed. And then there's also what we call major depressive disorders that are there. So they're very, very numerous. So yes, there are numerous types of depression.
Okay, so I guess you've talked about the difference between sadness and depression, right? So is there any treatment for it?
Yeah. So for treatment of depression, that's the one where you're having neurotransmitter what your neurotransmitters in your brain are imbalanced, leading to depression and things like that. The best is to seek medical attention where you're assessed properly, and then you can go through counseling as well as medication in some cases. But one thing that I feel like is important now is we need to be able to, like I said, I'm more interested in the community and preventive mental health. There are different ways of managing situations and coping with situations that can improve the ultimate mental health of the community. Things like just talking to someone when you're having some troubles can be a positive, can lead you to a positive mental health outcome, as well as socializing with friends and family is also a good one. Seeking mental health support early from a professional, from a counselor, is also a positive that prevents someone from going to depression. And then something that's very important that we're losing is good coping mechanisms that we have. Amongst them is having a culture of exercising. Exercising has been linked to positive physical health as well as mental health. So that's something that I'm a big advocate of. So find something that you like that keeps you active, and it also correlate with a good mental health. So those are the things that I feel as a community we need to strengthen to improve the mental health.
Okay, so were those preventions or treatments? Or it's both?
I started with the
With the
treatments
treatment?
where you have to go to a healthcare provider. They'll assess you, and then you undergo some therapy and possible medication when you've been diagnosed with depression. And then for prevention, for you and me, if you want to stay healthy physically and mentally, I mentioned those things about having a good social support, good coping mechanism, exercising, and also seeking early intervention when you are not mentally stable or you are undergoing a crisis.
The people are scared because of the stigma around it. They don't want to seek help.
Yeah, 1,000%. Mental health and mental issues have got large stigma, especially in our communities. And the negative impact that takes place is that they go to other places before they come and see the professionals.
Yeah.
They'll go to their traditional healers, they'll go and see religious leaders, they'll go and take alcohol and other substances and all those things. And then when things become very severe and dire, that's when they come
when
and
they
to see
decide
us. So one of the things that interviews like this and discussions like this does is raises awareness about mental health and make sure people seek services on time.
Right. So maybe because we're almost wrapping up, but just before that, maybe you could just put an emphasis on the early, you know, talk to people out there to seek the help that they need at the appropriate time.
Yeah. So mental health is pretty much brain health, and the brain is the most important part of your body, of your body. Don't you think so?
I think so.
Your
It
brain is you, eh?
Yes.
Your thoughts, your
because
everything.
of how I think, and yeah.
Yeah, so we need to protect it. And first things first, make sure you prevent any mental health challenges from coming to you. We live in a world that has changed from the past 100 years. 100 years ago, we used to hunt, or 200 years ago.
Yes.
We were hunters
We're
and gatherers.
hunters.
And then if we get stressed out by a lion chasing us,
Yeah.
that's the stressor. The lion is coming. We run away from the lion. The stressor is gone. But right now, what are our stressors? Our
A lot
stressors
of
are
things.
bills,
Yeah.
rentals. Are you going to run away from your house?
No, you can't.
Can't.
You
So
just have to find a way.
Yes. So you have to find a way of coping with those things. So one thing that would be good that is to build resilience in the population and all those things. So I encourage people to just be a bit more aware about themselves, about their mental health, and develop good preventive strategies and good coping mechanisms for you to have a healthy and productive life for yourself and your family.
Okay. Thank you for that. That was something informative. Now, just before we close, what could be your closing remarks on everything that we have talked about?
Like I've closed.
Yeah. Okay. Yeah.
Okay.
No. That one was an emphasis
Yes, that was an
on
emphasis.
yes, but what I'm asking for is the
Okay.
conclusion.
In
We
conclusion,
close it up.
yes. So, in conclusion, mental health is very important, and mental health is yourself. So, make sure you take care of yourself so that you can be able to take care of others and your families. Like it says, when you are getting on the plane, they tell you if that mask comes on for oxygen,
Yeah.
what do you do first? You put on your mask 1st so that you can help other people.
Yeah.
And that's one thing that I've taken to heart and I use as I'm living my life to take care of myself so that I can take care of my patients and also the people around me.
Right. Thank you so much, Doc, for that profound explanation. I think it has been helpful. It's helpful. It has helped me, and I'll use some of those strategies. And I'm sure it has helped a lot of people out there who are watching now. Yeah. So thank you for coming through. Thank you so much. And there you have it. You've heard from the doc. Take care of yourself, take care of your mind, because mental health is something that we should talk about. And conversations like this are helping us get more information about mental health and seek the appropriate help that we need. So please continue to tune in. We'll give you a lot more videos about mental health.